Hello, and welcome to Who Wants to Get an A in Med Micro. Hold on, let me get my Diet Dr. Pepper out of my bucket. I'm Caroline, your host, here with our contestant Sabrina, who is working to get an A in Med Micro. Alright, your first question. All of our questions are about campylobacteriosis. Which of the following doesn't belong as part of the etiology of campylobacteriosis? A. Small, curved, motile, gram-negative rod. B. Eating too much candy. C. Caused by bacteria Campylobacter. Or D. Leading bacterial cause of diarrhea in the U.S.
I think I'm gonna have to use a lifeline.
Okay, would you like to use your professional Call a Pro lifeline, your phone a friend lifeline, or your pulled audience lifeline?
I will call a professional. Let's call a lab technician.
Okay.
I have a sample here of a patient's stool. Yep, definitely gram-negative rods of campylobacteriosis. I'm thinking it's gotta be B, eating too much candy.
Is that your final answer?
Yes.
Good, B is correct. You have successfully earned an F- so far in Med Micro.
All
Next
right.
question. We have transmission, which does not apply to transmission. Campylobacteriosis is found in the GI tract of animals. Campylobacteriosis is passed by handling infected feces, ingesting contaminated food or water, or by taking a nap outside.
Well, I'm gonna have to go with D, taking a nap outside. I don't think that would give it to you.
Correct. You now have an F in Med Micro. Now we have a question about the pathogenesis, referring to the entry and attachment of campylobacteriosis. Which is wrong? A. It enters the host intestines after passing through the stomach's acid barrier. B. The bacteria colonize the mucus blanket that cover the intestine. C. They climb into the ear and attach to your brain. Or D. They penetrate the mucus layer using their polar flagella.
I think I'm gonna have to go with C, final answer.
Correct again. You've moved up to a D in Med Micro. Question number 4. How does campylobacteriosis overcome the host defenses? A. They battle with swords. B. They actively inhibit complement activation by covering the non-complement fixing agent to avoid lysis. C. Recombination. Or D. Program gene switching.
I'm gonna have to go with B.
Final answer?
Yes.
Good. You're now at a C-, Sabrina. Question number 5. Which of these does not have to do with the damage of the host? A. Causes blindness. B. Invasive and local destruction of gut mucosa. C. Ulceration and inflamed bleeding of mucosal surfaces, causing painful diarrhea. Or D. Production of cytotoxins.
I'm gonna have to go with A.
Final answer, causing blindness?
Yes.
Correct. You're now at a C. You are average right now, Sabrina.
All right.
Okay, remember, you still have 2 lifelines. You have phone a friend, and you have pulled audience left. Question number 6. What is not a clinical feature of campylobacteriosis? Many don't show symptoms. B. Lasts 2 to 5 days. C. Diarrhea and abdominal pain. Or D. Your skin turning purple.
I'm gonna phone a friend. I have a friend that's a doctor. I think she'd be able to help me out with this.
Okay.
Hello? Oh, hey, Sabrina. Uh-huh. Yeah, well, being a doctor, I know that some symptoms are diarrhea, high fever, vomiting, and abdominal pain. And most people's symptoms last about 2 to 5 days, and some people don't actually have symptoms at all. But how do I know? Because I have it right now.
Okay, well, did that help you at all with your decision?
I think so. I'm gonna have to go with D, skin turning purple.
Final answer?
Yes.
D is correct. You now have a C+. Question number 7. How is campylobacteriosis diagnosed? A. Fingernail clipping. B. A hair sample. C. A stool sample. Or D. A clothes sample. Remember, you still have full audience available.
I think I'm going to pull the audience for this one.
Okay, audience, please select your answers now.
Okay. The audience seems like a smart bunch of people, so I'm going to have to go with them. Final answer.
So you're going with C, a stool sample.
Yes.
Good. You now have a B in Med Micro. You're getting up there. You're probably higher than my grade. All right, next question. Which is not a course of treatment for campylobacteriosis? A. Drink lots of water. B. Drink electrolytes. C. Scarf down a bunch of candy. Or D. Take erythromycin orally with dose and duration depending on the severity of your diarrhea.
I'm going to have to go with eating a bunch of candy.
You are correct. You are at a B+ right now, Sabrina.
Wow.
All right. Next question. Mechanism of action of erythromycin. A. Hepatic metabolism, and it inhibits the protein synthesis by irreversibly binding to the 50S ribosomal subunit. B. Creates a cell hospital for sick cells. C. Hands out band-aids. Or D. Inhibits all of your nerve functions.
Ooh, that last one sounds pretty rough. I'm going to go with A.
You're correct. You now have an A in Med Micro. Okay, Sabrina, you're going for an A+ in Med Micro. This is your final question. Which is not a way to prevent campylobacteriosis? A. Wash your hands often. B. Cook your meat thoroughly. C. Avoid contaminated water and milk. Or D. Get a job as a lawn mower. And then, after you're done mowing lawns, get a job fixing lawn mowers.
Well, oh gosh, so much pressure.
I know for an A+ in Med Micro.
All right. I'm going to go with D.
You're correct.
You just won $1 million!